Fred, I'm so honored to have you on as a population health expert. Why don't you introduce who you are and the work that you do in healthcare?
Well, I'm Fred Goldstein. I'm the president of a company called Accountable Health, LLC. It's actually a consulting firm in the area of population health. And I've been in healthcare a fairly long time, starting as a hospital administrator, both med surg and psychiatric hospitals. And then I went and ran a startup HMO that originally served Medicaid beneficiaries. And we expanded into multi state and commercial business as well. Um, Founded my own chronic care management company and did a lot of work over about a 15-year period in disadvantaged populations, particularly Medicaid around the country with chronic illnesses. And for the last I finished about 5 years of that running a company called US Preventive Medicine that also did employee health improvement. And the last 7 years, I've been consulting across the population health space.
As it relates to COVID-19 and population health, what opportunities do you see presenting themselves to address improving population health?
Fortunate thing we're seeing with COVID-19 is it is clarifying to a lot of people, those who probably didn't know but should have, the strong impact that this disease, that this infection is having on disadvantaged populations. Those who are struggling with social determinants of health are really struggling with this illness, both from an infection rate and obviously from an outcomes rate, seeing higher death rates, et cetera. So I think it's allowing us to begin to expand the message from those of us who have spoken about this, that there's much more work we can do and should be doing to focus on those social determinants of health, because there's a clear disparity in outcomes that we're seeing with the illness. So the sad part obviously is what's happening, and that's giving us an opportunity to let people know we can do better and should be focusing more on these other issues besides just straight up healthcare and ensuring that the healthcare is appropriate.
Can you break down payment incentives and how that impacts access to care?
The way the healthcare system is structured today, you get paid for delivering a service, which typically has a CPT code for a physician or an NDC code for a drug or a DRG code for hospital admission. And because of that, we've created this system where people focus on doing those, and the more they do, the more they generate. But many of the issues that we face as to why we have high healthcare costs and poor outcomes are due to issues that have typically been looked at as outside of the healthcare system. These social determinants of health, where you live, as we now know, your zip code is a much better predictor of your health status than your healthcare system. I live here in Jacksonville, Florida. We have a very strong healthcare system. We have a university hospital. We have a Mayo. We have Baptist. We have St. Vincent's and others. Our healthcare system, I think, ranks about 10th out of 67 counties in the state. For the top is number one, obviously, but our outcomes, I believe, are still in the mid 40s. So although we have a great healthcare system, we have poor outcomes because of these other issues. So what we need to figure out what to do is, how do we move the funds to be able to address social determinants of health? And most people would say we can do that by adding a new billing code. We should bill for transportation. We should bill for housing. We should bill for this. That's a good idea in one sense, but the reality is about 30% or 25% of healthcare in the most recent study is considered waste, fraud, and abuse. That's probably somewhere on the order of $800 billion. So imagine what we could do if we could take that out and move that into addressing these social determinants of health. And that's what we talk about when I think about payment reform, is setting up systems where for the physicians and the healthcare systems, it makes sense to solve the housing problem because they'll actually do better than just worrying about the medical problem. And we're getting there with some ideas, but it's early.
If we strip back from the system itself and look at the role of the patient, how would you say the patient, underserved patients specifically, can use their voices to advocate effectively for change?
One of the big issues that the underserved population has had is that they don't get listened to. You know, it is a question of how much can they resonate with their own voice and obviously speaking up, but we need to help. We need other people assisting and speaking for them. And we have them all over the country. There are leaders in the communities who are out there voicing their concerns and saying we can do better. And there are some other leaders around the outside the community. And I think we need to come together and put together a message from all of us that it's time that we effectively address these underlying issues that are causing these great disparities we have in our health and outcomes, whether it's, maternal mortality rates for African American women, preterm babies, higher rates of diabetes and obesity, et cetera. And much of that is being driven, obviously, by these systematic things that are in place today that we need to correct.
What do you see as being the most effective way to address health disparities to ultimately improve health outcomes?
We need to focus on social determinants of health. We need to come up with adequate funding for those areas, but we also need to recognize that it's going to take a, a diverse group to solve it. The healthcare system alone is not going to solve this. They need to actually figure out, in my mind, how to take their waste out and their inefficiencies out so we can free up the dollars. And then we should be looking to community groups, governments, schools, activists, and the not-for-profits, and create a larger organization in a community. I call it, and David Nash and I wrote about this a number of years ago, the founding dean emeritus of the School of Population Health at Jefferson called an accountable health organization, which essentially takes what was originally the idea for an accountable care organization, which is just healthcare, and broaden it to include all of those other groups. And for example, in the city, set up an overall overarching group that includes healthcare, the government, the schools, the not-for-profits, and they look at the health of the community and allocate resources that way.
Let's look at population health from a community framework. What do you think needs to happen now in order for the population's health to be improved? Is it funding? Is it policy? And what would be your call to action?
This is an opportunity, although it's going to be very difficult because we're going up against a system that's the largest, and not against it in a sense, but that's the largest portion of our gross domestic product, the healthcare industry, and all its pieces. And we need to shift that. It needs to move. The problem is now we have doctors who are struggling trying to get funding because they've had to stop doing their practices. We have hospitals that are, losing millions and millions of dollars because they've closed down elective surgeries. But we can't use the fact that we need to just fund them the way they were before. We need to move them as we move to this new world and get them to recognize that the ultimate sign of success in the community would be the small hospital on the hill because the community's healthy, not the giant job creating hospital, because 25% of that is effectively inefficient spending. It's a hard way to look at it, but really we should be looking at shrinking those facilities. Obviously, we need them for things like COVID and be able to expand them out for pandemics, but so much of our health could be improved upstream that we should be using less of that downstream resource.
So, what would be your final thoughts around population health, around COVID-19, around addressing social determinants of health and healthcare disparities?
Unfortunately, those of us in my generation, in some sense, have left you with this healthcare system. Um, and it needs to be fixed. It can be fixed. There are many good people out there trying to do the right thing. We just need to make it happen. And so, if anything, your generation and others should say, we're gonna adjust the healthcare system so it creates health for everyone in the country, in the United States, and not just for the select few or those who can access a hospital or those who can get to a first-rate facility. But there's a whole bunch that we could do. Imagine how much less we would spend if we solved the diabetes problem, the pre-diabetes problem, the obesity problem, the preterm delivery issues that we know many of these are based on, well, I live in this neighborhood and this is all I have access to, or I have this type of resources to buy food and this is all I can get. We just need to improve that. And there are groups starting it. You're seeing some of the larger insurers suddenly say, let's pay for housing, let's do food out in the community, let's figure out how to solve education and health literacy. We need to pull all those resources together and once and for all fix it.
Thank you so very much for sharing your expertise in population health with us. I am just truly honored for the opportunity to learn from you. Thank you for being on this show.